we've got two questions here. Are the levels that we produce endogenously what we should be aiming for on testosterone therapy, even though there is no medical literature at all to support us doing that? And I asked this last week or the last time we met. Could it be that we are possibly more sensitive and responsive to our own production based on the complexity of physiological events that are involved in steroidogenesis, how it is released, and how it exerts its biological effects? Now, when we give testosterone, we bypass all of these complex physiologic events. And does it have an effect on our response? Do we need more when given exogenously to exert the same physiologic effect as when we produce it endogenously? From a clinical standpoint, we see that we do all the time. And the last question is, could it be that we need more testosterone levels as well, higher levels as well, to outcompete the endocrine disrupting chemicals that are actively competing for our androgen receptors? Do we need it for that? But, ultimately, Rudy will say this, Rick intuitively knows this, that dosing for testosterone should be based on a clinical response as well as safety and patient tolerability and not a specific number. So I'll get off my soapbox. So
hold on, what was the last thing you said? You broke up, not a specific number. What did you say? Not
we should be aiming for a clinical response, factoring in safety and patient tolerability. In other words, balancing the clinical effects, the symptomatic improvement, and balancing that against any unwanted side effects, and it's that simple to do. We should not be aiming for a specific number. Let's just say 700. Peter Attia just recently did a podcast. He'll treat those 700, and if a man gets a level of 700, doesn't have any clinical improvement, he'll stop testosterone. And so, once again, there's this fixation on this normal physiologic level, but our normal physiologic levels have declined significantly last several decades.
Right.
So that's another issue in and of itself. So the point is that super physiologic, that name has been hijacked. It now means abuse and danger and harm. And we could talk about the normal range. What was normal? What was normal just in July of 2017? That's when the new normal range was changed. What was normal? For instance, a level of 1100 was completely normal at LabCorp in July of 2017, in June of 2017. In July, it was changed. So are you telling me that it was healthy, normal, and beneficial to have a level of 1100 in June of 2017, but in July, if you had a level of 1100, it was abusive and it was harmful? It makes no sense.